Hello, everyone. Welcome to another review class for our very, very intelligent students from LAM. So today we shall continue with diabetes, and this time we will talk about managing complications. Okay, so for both type 1 and type 2, or what we call insulin and non-insulin dependent diabetics, the complications are common, which are due to high or when blood sugar levels are uncontrolled. No? And in Chinese medicine, the complications are usually due to, so just think of blood stasis and phlegm. And we all know that this can block the channels and network vessels in the chest, extremities, the skin, and the eyes. In rare cases, we will have a deficiency pattern, which may be the primary pathology behind the complication. So the primary strategy is to alleviate and prevent complications so that we can maintain tight control of the blood sugar levels. Okay, let's start with retinopathy. Now, diabetic retinopathy, it develops gradually, so it's not insidious, no, it's not acute, no. So it will take some time. Sometimes lalabo na lang yung mata mo, hindi mo alam. And this develops gradually and may progress without the patient being aware of visual loss until the pathology is quite advanced. So you have to seek a very good uh, ophthalmologist who will always look at the fundus or do a slit lamp. Or if you go to an optometrist, make sure that the slit lamp is part of the examination, because it is only through examining the fundus or the back of the eye that you can actually monitor the progression of your diabetes. No, so what happens when when the retina is damaged? You can see aneurysms in the capillaries, no? You can see hemorrhages, infarction, exudates, and edema. So when this happens, you will have blurred vision, black spots, or flashing lights. So if this is happening to you, time to have your blood sugar checked, no? This type of visual loss is due to blockage of the network of vessels in the eye caused by blood stasis and or phlegm dampness. The physical presence can be observed by examining the retina using the ophthalmoscope. So the more aneurysm and spot hemorrhages, the greater the degree of blood stasis. And the more edema and exudate, the more phlegm and dampness. So when it comes to blood issues, so think of blood stasis, no? Yung hemorrhages and aneurysm. If you see a lot of edema and exudates, that's phlegm. Occasionally, retinopathy and retinal bleeding may be due to a deficiency pattern, Qi and blood deficiency. Okay, so the most important one would be the points that you will have to do very, very regularly. So the first point is an extra point called Tsuho, which is like here. So dito yan siya. Divide this into 4, and dito siya sa 1/4, no? Or you may use the ear for this if you find this a little bit difficult. Bladder 1, gallbladder 20, and gallbladder 37. Okay. Next, we go to vascular disease. This is also a very, very common complication. Under this category, we have cardiac and peripheral vascular disease. So, ibig sabihin, affected yung heart, pati yung blood vessels mo in the periphery. So what are the main manifestations? You can have angina, myocardial infarction, mali ang spelling, sorry. That's infarction, hindi infraction. Stroke, claudication. I hope you're familiar with claudication, no? Sa paa nangyayari. Nocturnal leg pain, pagdating ng gabi, masakit yung paa mo, and also when you have vascular ulcers, nakakasugat-sugat yung mga kaugatan, no? Symptoms can become more severe where you notice that the vascular ulcers, they do not heal, no? And the ischemia will be deteriorating into necrosis. That means namatay na po yung tissue, okay? So main strategy, what is our strategy? Make sure that you move the blood, no? Kasi you want to prevent blood stasis no? So always invigorate and move the blood. So what are the points? Okay, PC4, PC6, REN17, and of course the very famous stomach 40. Next would be peripheral neuropathy. This is also a very common complication. This is due to nerve ischemia because of microvascular disease, increased viscosity of blood, and effect of because diba, when the blood sugar goes up, it really affects the nerves, the nerve cells, no? So namamatay yung neurons, so there will be no more innervation, no more blood supply coming to the microvessels. So what are the signs and symptoms of peripheral neuropathy? You will have numbness, tingling, burning in the hands and feet, and or loss of sensitivity to temperature and touch. So this is a little bit concerning, no? So hindi mo nararamdaman yung init. Okay? Muscle weakness and atrophy. Treatment, you should focus on the constitution of the patient. Okay, making sure they manage their blood glucose and Qi and blood deficiency or blood stasis, if any of these are present. So the points would be the following: Li15, Li11, Li10, Li4, stomach 36, and stomach 40. So the idea here is to prevent further neuropathy, to prevent, especially when your blood sugar is uncontrolled. Next, nephropathy naman, the kidneys. Okay? Diabetic nephropathy is a serious late-stage complication. There is thickening and sclerosis of the glomerular network, no? So when this happens, when there is sclerosis of the glomerulus, there will be reduced renal capacity, so there will be kidney failure, and this time you will need dialysis. And I'm sure you're very familiar how a patient who requires dialysis looks like. And the bad news here is the complication. Nephropathy is asymptomatic until significant damage has occurred. So do not be too complacent because you're not feeling anything. That means you're okay lang yung kidneys mo, no? So do urinalysis. If you find that you will see a lot of albumin or protein in your urine, that is a that suggests that there is now kidney damage. Okay, mataas yung albumin, mataas yung protein sa urine. So the treatment here is, of course, we all know that when the kidneys are affected, there is no more, you cannot regenerate. So the goal here is to slow down the progress of nephropathy. So the underlying pattern is typically Qi, yin or yang deficiency with blood stasis. So the points, bladder 52, so that's about 1.5 tune from bladder 23, diba? So layuan mo pa ng konti. And then we have kidney 3, kidney 7, very popular, and of course stomach 28. Now, okay, most diabetics, as a complication, they develop skin infections, boils, and sores, just like somebody I know here. No, he is the blood sugar, malakas kasi kumain. So, and nagkaroon siya ng, parangko, no, carbuncle. So diabetics kasi are prone to recurrent suppurative sores. So if this happens to you, maybe you should have your blood sugar checked already. In general, these are due to damp heat or toxic heat. Damp heat or toxic heat lingering in the skin because of reduced ability of the normal Qi to expel the pathogen. Kasi nga mahina yung Qi mo, no? So how do we manage this? Very easy. We have there's a very popular, ano ba tawag dito? We call this a empirical point. So that means you don't really know why they use it. Do 10. Okay, you can use also do 12, Li4, and bladder 40. So in case you can relate to this, why not use these points? I'll give you a copy of the answers on the group chat. Thank you very much for listening. And we will continue next week, still on diabetes.